SLE is a systemic lupus erythematosus. It is an autoimmune condition where your own immune system targets your own cells, so thereby causing widespread inflammation affecting multiple organs. The most common organ involvement is the skin, joint. The major organ involvement is the kidney, brain, lung, etc. The lupus usually presented with the constellation of the symptoms. The most common mucocutaneous symptoms are malar rash, where you develop a butterfly rash over the cheek and bridging the nose. You develop the photosensitivity rash, particularly at the sun exposed area. Then you can develop joint pain, recurrent oral ulcer, nasal ulcer, easy fatigability, recurrent hair loss, and you can develop symptoms related to major organ involvement. Like if you have a kidney involvement, you can develop with the palatal rolling, swelling, facial swelling. If you have a brain involvement, you can present with the seizures, stroke, psychiatric symptoms. If you have a lung involvement, you have a breathlessness, dry cough, etc. Lupus usually affects the women of childbearing age, that is from the 15 to 45 years. It has seen that 20% it can also affect in the children, that is less than 18 years of age. They are labeled as juvenile SLE. So as I said, the lupus is a chronic autoimmune disorder. So it is not that in 2 to 3 weeks you develop the symptoms. It is over a months or years you have the constellation of symptoms. Not all the symptoms will come at a time to a patient. It is a one-to-one. Like if you develop cutaneous symptom, then you can develop joint pain later. So it is over months to years you develop a symptoms, constellation of symptoms, where you go and have to consult a rheumatologist. There are various triggers. The various triggers include the ultraviolet light, particularly when you go to sunlight. So we advise patient to take a umbrella or wear a full dress. Second is viral infection. So most common is the Epstein-Barr virus, which can flare the lupus. Third is stress. Fourth, smoking. Fifth, drugs. There are some drugs which can flare the lupus, particularly some anti-TB drugs and some anti-seizures, anti-epileptic medicines. There are different kinds of treatment available. It depends upon what stage of the disease you are, whether you are in minor organ involvement or you are major organ involvement. If it is minor organ involvement, we just treat with the oral medicines, and these medicines are usually immunosuppressants. And major organ involvement, there are injectable forms. These has to be, patient need to be admitted for it. The minor involvement just can be managed on OPD basis. The major organ involvement, patient need to be admitted, has to be given injection and need a close follow-up. The first important is to take up the disease. Particularly, it's very important to counsel. Lot of still in the lay people, they think that arthritis affects the elderly population. So it is usually this lupus affects, as I said, in the women childbearing age. So first of all, to believe that whether they have lupus is the biggest challenge. Second, the medicines associated. As I said, it is a chronic disease and it has to be a long-term follow-up. It is not like one time you consult a doctor, take a medicine and forget. No, you should be on close follow-up to a doctor, because the most common presentation of lupus is a minor organ. What are minor organ? Like mucocutaneous, joint pain, etc. So if you don't follow up a patient to a doctor, then over months you can involve the major organs. So when major organ is involved, the prognosis is very bad. So this is the second challenge. The third challenge is particularly, as I said, it's a woman of childbearing age. So there are medicines which are not to be taken during pregnancy. So before you plan a pregnancy, go and consult a rheumatologist. The disease has to be controlled 6 months prior to pregnancy. Why? Because pregnancy itself is a risk factor for the flare of lupus. It can involve the major organ involvement during the pregnancy. The reason being the estrogen content during the pregnancy, being high during the pregnancy. And the fourth thing is the pregnancy in lupus, they have lot of mortality. Mortality in the sense they'll have a major organ involvement, and there is high risk of pregnancy-induced hypertension. So these are the difficulty which a woman of childbearing age with lupus will face. Patient who are minor organ with active disease, not managed properly, they can get relapse once they get treated. It can relapse to a major organ involvement also. So we give a medicine called as hydroxychloroquine to prevent a relapse. So this medicine is must for those who have minor organ also and major organ also. So additional medicine would depend upon whether patient have minor organ or major organ.